Asthma is a chronic respiratory condition that affects millions of people around the world. It can have a significant impact on daily life, but with the proper management, most people with asthma can live full, active lives. In this video, we'll explore what asthma is, its causes, the symptoms people experience, and how it can be effectively managed. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Asthma is a condition that affects the airways in your lungs. The airways are tubes that carry air in and out of your lungs. When you have asthma, these airways are always somewhat inflamed. This inflammation makes the airways more sensitive to various triggers, which can lead to asthma attacks. During an asthma attack, the muscles around the airways tighten, the lining of the airways swells, and the production of mucus increases. These changes cause the airways to become narrower, making it difficult to breathe. The exact cause of asthma isn't fully understood, but it's believed to result from a combination of genetic and environmental factors. If you have a family history of asthma or other allergic conditions like hay fever or eczema, you may be more likely to develop asthma. Environmental factors can also play a significant role. For instance, exposure to allergens such as dust mites, pollen, mold, and pet dander can trigger asthma symptoms. Additionally, irritants like cigarette smoke, air pollution, strong odors, and even cold air can set off an asthma attack. Respiratory infections, physical exertion, and stress are also common triggers. Asthma symptoms can vary from person to person and can range from mild to severe. The most common symptoms include wheezing, which is a whistling sound when you breathe, shortness of breath, chest tightness, and coughing, especially at night or early in the morning. These symptoms can come and go and may worsen in response to certain triggers. For some people, asthma symptoms are a minor nuisance, but for others, they can be severe and interfere with daily activities. When asthma symptoms worsen and become more severe, it is referred to as an asthma attack or exacerbation. During an asthma attack, breathing becomes increasingly difficult as the airways constrict and more mucus is produced. This can lead to a dangerous situation if not treated promptly. In severe cases, asthma attacks can be life-threatening, requiring immediate medical attention. Understanding your asthma triggers and learning how to manage your symptoms are crucial steps in living well with asthma. One of the most important aspects of asthma management is avoiding triggers that can cause your symptoms to worsen. If you know that pollen triggers your asthma, for example, you can take steps to minimize your exposure during high pollen seasons by staying indoors with the windows closed, using air conditioning, and avoiding outdoor activities when pollen levels are high. Similarly, if cigarette smoke is a trigger, it's important to avoid smoking and exposure to secondhand smoke. Medications are a key component of asthma management, and they fall into two main categories: long-term control medications and quick relief medications. Long-term control medications are taken daily to help reduce airway inflammation and prevent asthma symptoms. These medications include inhaled corticosteroids, which are the most effective long-term treatment for controlling persistent asthma. Inhaled corticosteroids work by reducing inflammation in the airways, making them less sensitive to triggers. Other long-term control medications include long-acting beta agonists, which help keep the airways open by relaxing the muscles around them, and leukotriene modifiers such as montelukast, which blocks substances in the body that can cause asthma symptoms. Quick relief medications, also known as rescue inhalers, are used during an asthma attack to provide fast relief from symptoms. The most common quick relief medication is a short-acting beta agonist, such as albuterol. This type of medication works quickly to relax the muscles around the airways, allowing them to open up and making it easier to breathe. It's important to always have your rescue inhaler with you in case of an asthma attack, but it's also crucial to understand that relying on quick relief medications alone is not the best way to manage asthma. If you find yourself using your rescue inhaler more than twice a week, it may be a sign that your asthma is not well controlled, and you should talk to your doctor about adjusting your treatment plan. I just want to take a moment to ask that you hit that like button, subscribe to my channel, and leave a comment below if you have any topics you wish to be discussed in future videos, or if you want to share your experience and tips about asthma. Anyway, in addition to medications, there are other strategies that can help manage asthma and reduce the frequency and severity of symptoms. One important strategy is using a peak flow meter, a small handheld device that measures how well air moves out of your lungs. By regularly monitoring your peak flow, you can get a sense of how well your asthma is controlled and whether your airways are narrowing before you even notice symptoms. This can help you take action early to prevent an asthma attack. Another key part of asthma management is having an asthma action plan. An asthma action plan is a written document that you create with your doctor that outlines what to do on a daily basis to manage your asthma, as well as how to recognize and respond to worsening symptoms or an asthma attack. The plan typically includes information on your daily medications, when to use your rescue inhaler, and when to seek medical help. Having a clear plan in place can help you feel more in control of your asthma and reduce the anxiety that can come with managing a chronic condition. It's also important to consider lifestyle changes that can support your overall lung health and reduce asthma symptoms. Regular physical activity is beneficial for most people with asthma, as it can improve lung function and reduce the frequency of asthma symptoms over time. However, it's important to be aware that exercise itself can be a trigger for some people with asthma, a condition known as exercise-induced bronchoconstriction. If this is the case for you, your doctor can recommend strategies such as taking medication before exercise to help prevent symptoms. Maintaining a healthy weight is another important aspect of asthma management. Being overweight or obese can worsen asthma symptoms and make the condition more difficult to control. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can support overall health and help you maintain a healthy weight. In some cases, certain foods or food additives may trigger asthma symptoms, so it's important to pay attention to how your body responds to different foods and adjust your diet accordingly. Managing stress is also an important part of living well with asthma. Stress and anxiety can trigger asthma symptoms or make them worse, so finding healthy ways to cope with stress is crucial. This might include practicing relaxation techniques such as deep breathing, meditation, or yoga, as well as making time for activities that you enjoy that help you unwind. For children with asthma, it's especially important for parents and caregivers to be involved in managing the condition. This includes helping the child understand their asthma and what triggers it, ensuring that they take their medications as prescribed, and working with the child's school to make sure that appropriate measures are in place to manage asthma during the school day. Schools should have a copy of the child's asthma action plan, and teachers and staff should be aware of what to do in case of an asthma attack. Asthma can be a challenging condition to live with, but with the right management strategies, most people with asthma can lead healthy, active lives. It's important to work closely with your doctor to develop a personalized asthma management plan that works for you. This includes identifying your triggers, taking your medications as prescribed, and making lifestyle changes that support your overall health. By taking a proactive approach to managing your asthma, you can reduce your symptoms, prevent asthma attacks, and enjoy a better quality of life. Thank you for watching. As always, take care of yourself and make the most of your day.